Hello, everyone. So I suppose I'd like to say thanks very much to the All Ireland Institute for Hospice Palliative Care for allowing us to give our humble brag here this morning, this afternoon, I should say. The lunch hasn't done me any favours, I don't think. In relation to ourselves, well, thanks for introducing us. We work in DKIT. We looked at simulation-based learning because we know it's a valuable approach to healthcare education. It offers a safe and immersive environment, if you like, for those undertaking education. It's very important, I suppose, from a palliative care perspective. Well, it's important everywhere, but important from a palliative care perspective. It does allow healthcare professionals to develop and refine, if you like, their essential skills, such as communication, such as assessment, decision making, or indeed, if you like, symptom management. In January of this year, as part of our collaboration, we were delighted to be involved with our specialist palliative care services in the northeast. So that's Louth, Cavan, Monaghan. I hope I've said them all there now. In relation to developing a simulation for putting into our level 8 palliative care programme. In terms of what we're delivering here this morning, this afternoon, we're talking about the profile of our students, where there are 12 students undertaking this programme. They were from various backgrounds and disciplines. So we had nurses who were in nursing homes, we had nurses in intellectual disability in residential area, and we had nurses from the acute setting. So they were our cohort. Overall, the aims of our small initiative was to enhance postgraduate students' competencies and indeed their confidence in conducting and undertaking, if you like, their palliative care needs assessment, so that they could use that in their own individual setting. The focus was also to identify current and future needs, if you like, with regards to individuals living with a life-limiting illness. Also to identify appropriate referral points. So the simulation that we developed was a realistic scenario. We, as I said earlier on, it was a collaborative approach that we took with specialist palliative care services in the region. So this wouldn't have been possible without their input, I have to stress that. The team that we had around us in developing it, there was ourselves in Dundalk, and I have a simulation course. We had specialist palliative care, so we had a consultant in palliative medicine, we had practice development from specialist palliative care, we had a CNS who worked on the METAL programme. So they were the team that helped us devise the scenario. The scenario itself is based on an 80-year-old lady who had a stroke and that she wasn't able to be cared for at home by her husband, or indeed the input from the family. She only had one son. And so they had discussions, and she was going into a nursing home. That was a decision that they had made. And at that point is where our students would have engaged with this particular lady. The simulation had 3 different time points to it. First was obviously admitting into the nursing home. There was a deterioration of the lady, which would initiate, I suppose, a further undertaking of the palliative care needs assessment, and then a further deterioration. In between running the simulation, we stopped at each of those points. We ran the first point, stopped, debriefed, ran the second point, stopped, debriefed, and ran the last one. And then we evaluated it at the end. Our students engaged in the simulation. They were embedded in the simulation, so they volunteered to actually be the person undertaking the palliative care needs assessment, and they were set up for all of this with a pre-brief in terms of the situation and the context.